When palpating any bony prominence or any bony landmark, you always want to have a go-to landmark, an obvious bony landmark. The obvious bony landmark in the shoulder complex is the clavicle. We want to be able to palpate the proximal end of the clavicle. We will be able to palpate the distal end of the clavicle. As we palpate towards the proximal end of the clavicle, you're going to feel it getting larger. The actual head of the clavicle drops into a notch. That notch is called the jugular notch, which is on the manubrium. The manubrium is part of the breastbone. So we have the manubrium, the jugular notch of the manubrium, the proximal end of the clavicle, and between those two we have the sternoclavicular joint, and that's the notch in between the two. From that sternoclavicular joint, we are going to palpate the clavicle to its distal end. It's going to come to a more prominent bumpy edge, then it tends to want to drop off. And that point which it drops off onto another bone is the acromioclavicular joint. That bone that is shaped kind of like a shield or the shoulder like this, and it's smooth and large, is called the acromion process. The acromion process is one of our other main obvious bony landmarks in the shoulder complex. From that point, we are going to come from the acromion process diagonally to the midline of the body and drop down about 1 inch. So about 2 fingers width is about 1 inch, and then we will push down in that area. In that area, depending on the musculature or tissue that the patient has, we will be pushing deeper or not as deep, of course, with Brenda here. And we will palpate the coracoid process. Going back up to the acromion process, I am going to then palpate straight down the arm and grabbing their hand like a arm wrestler, I'm going to be able to control her arm in an internal and external rotation direction. Going back from the acromion process, dropping straight down the arm, about 2 fingers width again, about 1 inch, we are going to put the tips of our fingers directly down into the proximal humerus like this. And then internally and externally rotate the humerus. And I will be able to feel that bicipital groove, sometimes called the IT groove. I will feel myself pop out of the groove, into the groove, and out of the groove. In extreme internal rotation, I'm out of the groove. In the midline, approximately, I'm in the groove. And in extreme external rotation, I'm out of the groove. So, out of the groove, in the groove, out of the groove. In the groove, out of the groove. In the groove, out of the groove. From that point, I'm going to go back up to the acromion process and drop on both sides of the shoulder, grabbing like a C grip and grabbing the whole shoulder, knowing that I'm going to be grabbing a lot of the deltoid musculature at the same time. But my goal is to grab the head of the humerus and know that that is the head of the humerus because I can move it anterior medial and distal or posterior lateral, anterior medial, posterior lateral, and I can feel the glenohumeral joint move. And that is how we palpate the head of the humerus. So, in review, we are palpating the clavicle, the manubrium, the SC joint or sternoclavicular joint between the two, the clavicle and the acromion process, and the acromioclavicular joint between the two, the coracoid process, which is in a diagonal 1 inch drop, the IT groove or bicipital groove, which is a purely distal straight 1 inch drop, and the head of the humerus.